Hi, I'm Dr. Craig Escuday, President of Intellectability. Welcome to Medical Monday. Today we're going to spend a few minutes talking about something that is very important, and that is the need and the importance of educating healthcare providers in providing capable, compassionate, and competent healthcare to people with intellectual and developmental disabilities. There's a study that is just published, it's just been published, that really sheds, unfortunately, an unfavorable light on healthcare providers providing healthcare for people with disabilities. The study was conducted by a survey of a large number of nurses who have worked in the field of providing healthcare for people with intellectual and developmental disabilities for many years. They were asked to describe positive experiences that they've had with healthcare providers, as well as negative experiences that they've had. Unfortunately, two-thirds of the comments were about negative experiences, and they were quite enlightening. You know, not all of us like to read medical studies, but I tell you, I would encourage you to read this one. It's a very easy read, but it's also very captivating and really sheds light on the importance of improving the capability of the healthcare system to provide appropriate healthcare to people with disabilities. You know, a couple of comments just to give you a teaser into this study. One nurse said that during a consultation with an emergency room physician, the doctor stated that people like my patient aren't meant to live that long and have no quality of life. Another one talked about that they had a number of physicians. Instead of treating that person, they recommended hospice because of a poor quality of life. Another one said, I had a doctor totally ignore what I was saying and started the individual on psychiatric medications. Unfortunately, this is an issue that's all too common in this field. People, healthcare providers don't necessarily understand the connection between behaviors and medical conditions. And so a person presents to them who has a disability and they have some sort of adverse behavior. Maybe they're hurting themselves or hitting their arm or banging their head or hurting others. And the first thing they think is that, well, they're doing this because they have a disability or they have a mental health problem, so we need to put them on a medication to stop that. Rather than realizing that many times this is caused by some sort of pain or discomfort, and this person's only way of communicating this is through adverse behaviors. This study, when you read it, it will be heartbreaking to you. If you work in this field, if you have a family member in this field, I can almost guarantee that you've had these experiences. We as a society need to do more. We need to provide education to healthcare providers. That is the thing that I am most passionate about in this field. That's why I do what I do today. That's why I'm speaking to you today. That's what our company, Intellectability, is built upon. It's about helping people who work with people, who support people with disabilities, to be able to recognize health risks and to be able to receive appropriate treatment, help people that they support receive appropriate treatment for these health issues, and not have them covered up, not have them missed, so that people suffer needlessly. We have to remember that people with disabilities are people first. We need to see them as people. We need to recognize that quality of life for people may be different, but it doesn't mean it shouldn't be valued. It doesn't mean it's not valuable to that person. We at our company have tools and training to train everyone at every level, from direct support professionals all the way up to physicians. And I hope that you add your voice to the need to improve education to physicians, to nurses, to anyone who works in the healthcare field, and let them know that there are tools out there now. There haven't been tools available, but there are tools out there now. You can take a look at the curriculum in IDD healthcare on our website at replacingrisk.com. It's a concise training program to help provide needed and valuable information to clinicians so that anyone with any level of disability or without a disability can walk into any clinician's office or hospital or emergency room and receive appropriate, compassionate medical care. Thanks for joining me today, and thanks for adding your voice to this cause.